Emergency Preparedness Plan. Emergency planning. If the weather is treacherous, please do not make a visit to your patients. Call the office to report a missed visit and stay safe. You come first when it comes to safety, so if you do not feel comfortable driving in certain weather or areas, please communicate with your volunteer manager. Comprehensive emergency preparedness program utilizing an all-hazards approach. Risk assessment and planning. Our emergency preparedness plan is based on our organization and community risk assessments and utilizing an all-hazards approach. Address patient populations, services offered for continuity of operations, and succession plans. Policies and procedures. Our emergency preparedness policies and procedures are based on the risk assessment, emergency plan, and communication plan. Address subsistence, needs, and patient tracking, evacuation, sheltering in place, protection of medical documentation, and arrangements with other providers in the event of patient transfer. Communication plan. Our emergency preparedness communication plan complies with federal, state, and local laws. Includes contact information for relevant partners, methods to share protected patient information, and primary and alternate means of communication. Training and testing. Our emergency preparedness training and testing program is based on the risk assessment, emergency plan, and communication plan. We complete training and testing of our emergency preparedness policies and procedures. Risk assessment and planning. The emergency plan is based on our documented organization-based and community-based risk assessments using an all-hazards approach. The all-hazards approach does account for location. All-hazards planning does not address any specific potential threat, but promotes a facility's readiness to respond to a broad range of emergencies. The emergency plan includes strategies to address the emergencies identified by the risk assessments, including the management of the consequences of power failures, natural disasters, and other emergencies that would affect our hospice's ability to provide care. Communication plan. The communication plan includes how the organization coordinates patient care across healthcare providers with state and local public health departments, emergency medical services, and law enforcement. Contact information is readily available and accessible to leadership and staff. All contact information is current and accurate. Contact information. The communication plan includes both names and contact information for staff, entities providing services under contract, patients' physicians, other hospices, and the communication plan also includes contact information for federal, state, tribal, regional, and local emergency preparedness staff. Other identified sources of assistance. In the new hospice emergency phone tree, the volunteer manager will provide communication to the volunteers. Training and testing. Full-scale exercise that is community-based or a facility-based functional exercise. A mock disaster drill. A tabletop exercise or workshop that is led by a facilitator and includes a group discussion using a narrated, clinically relevant emergency scenario. A set of problem statements, directed messages, or prepared questions designed to challenge an emergency plan.